Let's now have the discussion. I'm joined on set by Daktari Marianne Mureithi. I do appreciate your time, Daktari. Thank you for coming. Always a pleasure to have you. She's microbiologist at the University of Nairobi and the chair, Department of Medical Microbiology at the University of Nairobi. Good morning, Daktari. I appreciate your time.
Good morning.
And we equally have Kate Kibara. She is a hydrotherapist. I appreciate your time. Thank you so much for coming. What a time to have you and to discuss this matter, which is equally very pertinent, and you lie very much, both of you and the other doctors across the country, much at the epicenter, and you saw the fulcrum point and the significant factor in regard to the Kenyan public understanding the coronavirus crisis. Therefore, you come a part of the discussion. This conversation belongs to you, the Kenyan public, because we, the Fourth Estate, lie at the center of managing the balance between what you need to understand, what you need to know, what the government should tell you, and what the experts, the medical experts should be telling us in terms of explaining and bringing to our understanding in regard to not only the coronavirus crisis, but any pandemic across the globe. Therefore, the number is 0791478990. The hashtag on Twitter is NewDayKE. The short SMS code is 40920. Dr. Mureithi, if I may come to you first. Yesterday, we had a caller from Nakuru County, and Esther, I presume, she wanted to understand why the coronavirus is called COVID-19. Maybe if we can have a layman understanding, and I presume she's also tuned for to understand why COVID-19, meaning coronavirus.
Okay, thank you very much for having me in this show, and maybe to try and demystify and debunk this virus that has taken the world by shock, actually. So coronaviruses, let's start from there, have been there for many years.
Okay.
It's a big family of viruses, okay?
Okay.
And we've been having human coronaviruses circulating, and I believe me and you and everybody else here has had a coronavirus infection of the humankind.
Okay.
And that they cause mild respiratory tract infection. They also cause 30% of our common colds. So in the last few years, newer coronaviruses have emerged that have been circulating in the animal kingdom, if I can call them that. So we call them zoonotic coronaviruses that have now somehow jumped species from animal to human.
Okay.
These coronaviruses are examples. We have SARS, that's severe acute respiratory syndrome coronavirus. And then we have MERS, that was first described in camels, that then jumped species to humans. Now we have this new one that has been discovered in the last 3-4 months.
Okay.
Again, very similar when you look at it under the microscope to the coronaviruses, and they're calling it a sister to SARS, the one I've mentioned, because they have very similar structures. They have, first of all, they're round in shape, as you've seen, but what is striking about them, they have the spikes. And they use those spikes, and you have all those pictures, to attach themselves to human cells. These spikes give it a crown-like structure. And when they were naming these viruses, they name them by, most of the time, how they look like.
Okay.
So corona comes from the word crown in Latin.
Okay.
And that's why we are calling it a coronavirus, and looks very similar to other coronaviruses. Why COVID-19? It's simply CO standing for coronavirus, the CO and V.
Okay.
D is disease, and 19 when it was first described. You know, we were calling it the Wuhan virus. Yesterday I saw Trump calling it the Chinese virus.
Foreign virus.
Foreign and all. We want we don't want to associate the Chinese and all with this stigma. So we really have to be careful how we are calling it. And that's why WHO sat down and said we're calling it the COVID-19. And that's what we are facing now.
Okay,
so hopefully for Esther, you know, it's a bit clear.
Very bit clear. I have also come to the understanding, which is CO stands for coronavirus.
Yes.
V is viruses. And then you have 19. The year it was, or the time it epicentered in the city of Wuhan in Hubei province.
Yes.
Well, that is a very good breakdown and understanding for that matter. If I may come to you on the far end, that is Kate Kibara. We will talk at it from the perspective to which it might overstretch our health capacities, our health infrastructure, and what the government needs to do, both at the national level and at the county government level, because what's at stake is the Kenyan population, the Kenyan people. But given what we have witnessed so far, the 3 cases that we have, what do you think the government should adopt first in regard to ensuring that all our isolation facilities are up to task, up to the challenge in regard to containing the virus from further spread so that we can contain the number we have, manage that number, and keep the Kenyan people safe?
Thank you so much for having me here. I think so far the government is doing what they should be doing in terms of containing this virus. We're actually pleased to see the reported cases that had already been isolated. We have seen the county hospitals, the Kenyatta Hospital and the Bagathi Hospital having the isolation center. So I think because the action has already been taken, we are actually a little bit ahead in terms of controlling it. When you look at the hospitals around, yesterday I was watching a clip where some hospitals were saying they actually need to get more equipment to help in, especially the isolation center. So I think the first most important step is, as much as we have the isolation center, is to now protect the county officials or the people who are actually, who are the ones who are getting in contact or the ones who are doing the tests. That is very important. So they're also protected as the medical providers or the people who will be in these hospitals. Apart from this, having enough information, information dissemination, and which is happening quite well. If you check around, there's a lot of advertisement, there's a lot of information. You've even seen as early as yesterday, all those people who are trying to bring in fake information, like there's a fake testing
kits, in 15 minutes.
Buy. Yes, and I think within a short period of time, within the first case that was identified on Friday, up to date, we have learned so much on how to preventive measures, especially now as the society, as this community. But what the government needs to work on is on these congested areas. We keep being told you need to keep your distance, you need to keep yourself in isolation, or just to that social contact, you need to reduce this. But you find a lot of us, unfortunately, majority, live in areas that are already congested. So if the government can look into a way of trying to penetrate into these areas where there's so much congestion, do a lot of capacity building, educate them, and see what can be provided there. When you look at the level of the same community, we are all rushing to buy these sanitizers and to do all this and stocking up food. So this is also information that needs to be given out there so that it helps. But at the county level, the government needs to equip all the hospitals, all the government hospitals around Kenya with whatever that is required to protect those that are the medical expertise out there, and also to protect the community. Okay,
we'll come to the capacity of our response and of course, the important element of standing up to the task when the time calls on. Dr. Mureithi, if I may come to you, and before we go to the deep sense of the discussion here in regard to this not being the most of deadliest in terms of the pandemics that have been recorded in modern history, because we have had the Spanish influenza of 1918, 1919, which literally had enormous effect on the globe, and equal the heat wave of 2003, which killed 70,000 people, but was never paid attention to. But we are technically in the midst of the pandemic here in the country, and will play our fair share role as Kenya, but be part of the global community that is rushing to develop a vaccine, that's rushing to contain the measure through the containment measures. But what do you say to the people who have the fears, or who have the fears that coronavirus is a death sentence?
First of all, let's start with hope. You remember the chart you've shown from Johns Hopkins, showing the number of people who've gotten infected. They're around 180. But there's a number there that I want us to focus on.
The recovered cases.
The recovered cases.
Almost 80,000.
80,000 are recovering. So it means there's some hope, but not to demean the people who've died. Any life that succumbs to this is serious. We have now, I think, the 7,000.
7,000.
Yeah, about 7,000 people. So really, it's not a death sentence, but we can take control of this by simply observing what we're being told at the moment by the ministry, and this is, first of all, hygiene measures. Wash our hands. Why are they telling us to wash our hands? Again, let me not take you back to where my microbiology hat. Soap. First of all, let me look at the virus. The virus, the spikes I mentioned, are held together simply by some bonds that quickly disintegrate in the presence of soap. And that's why if we are lacking sanitizers at the moment, or there's this big cry there are no sanitizers, we should not panic and say, no, this is it. Simply soap and water, simple soap, panga soap, sunlight soap, can quickly disintegrate this virus that could be on our environment. So if we can observe these measures first, and then listen now to being told right now to social distancing. As much as we have the challenges of overcrowding, we probably have no clean running water, most of us.
And Kenya being a social society.
Yeah, we are very social, we interact a lot. Let's try our level best to observe these measures. That way, we will not be saying, oh my goodness, we are going to die. We can take control of this. And I'm sure at the end of the day, we'll reassess and say, hey, Kenyans, by the second, third case that was reported, we really took charge, started cleaning our hands, started being vigilant, we've closed our schools, we were able to reduce the number of cases. I believe they will increase, because this is a very contagious infection.
Okay.
It's new, our immune system has not seen it, so it's going to increase, but we want to make sure the increase of rates of infections is very slow, minimum, so that our health system can cope, can catch these infections early enough, treat them early enough, and prevent that community spread of this infection, because that is what you don't want to get.
Okay, that's simply more or less like being in a biology class, because the soap and the water weakens the bond that holds together.
Not just weakens, destroys it.
Completely.
Completely.
Which means that if you can't access sanitizers, that's good to go with soap and water.
Soap and water.
Okay.
And not just any sanitizer. It has to have at least 60% of alcohol.
Okay.
At least 60 to 80%. That will also somehow disintegrate this virus.
Okay. Daktari, what about, before I go to Kate Kibara, what about the, because I opted for that, what about the surgical spirits?
Yes, there's that debate of surgical spirits, and I believe surgical spirits also have some component of alcohol. But if you cannot get, you cannot have access to surgical spirit or sanitizer, for me, my main message here is simple soap and water.
Okay.
And really, as Kate has mentioned, we now need this capacity to be built. There are people who have not seen water in a very long time. Can we have designated areas where these places can have water? I've seen that in Kigali, where in the bus stops, in Rwanda, where there's water running, and people being taught how the etiquette of cleaning, the maneuvers that you need to employ to make sure you've captured all areas of your hands. I know this question is coming again, why the hands, why the cleaning, and maybe we can answer that.
Okay, no, we'll come to that. We'll come back to that, because we will be taking step-by-step measure for the audience to understand and get the deeper meaning in containing this virus, because as was the case with the swine flu in 2009, it's here to stay with us. All the same though, after all. And Kate Kibara, if I may come to you, talk to me about the social setup of the Kenyan society vis-a-vis the measures taken by the government to contain this virus. How do we balance that?
I think the social setup we have is that we are a very social society. You find that we like traveling, we like visiting, we are always with people. We find that even if we are given the instructions, you need to self-isolate, especially probably maybe you've come back from Europe, or you feel like you have come from an area that had the virus, we end up having these social gatherings that come by default. It could be where you live with your family, you live many people. It could be functions. Let's talk about churches. We have a lot of churches where we have to gather. We have a lot of gatherings that are there. So our social state has so far is such that it is, I don't want to call it diluted, but it is at a risk, because we are always out there, we are always doing things. And the best thing is if we followed what we are told, and I think that's one of the best preventive measures of this disease, just follow the instructions. Simple things like washing your hands, keeping that social distance will actually help with you contracting this virus, because you contract it from droplets from someone who has it. So if you keep off and you keep this social circle reduced, you know, all these gatherings. I was to attend a birthday party this Saturday.
So you had to cancel?
It has been cancelled by the organizers. And I was like, this is very good. They thought it's not going to work well with our social society. So I think we need to minimize everything we're doing. And I'm happy about the schools being closed, the universities. It has the government has acted so fast, really, really fast, because you would not have expected. Why are schools being closed now? But it is actually for the good of our social society, where we are always out there, we are always meeting people. You know, public transport I would talk about. So I think it's a good thing to follow the rules and also to keep our social distance.
Okay,
Yeah.
Given that, and of course many Kenyans have adhered to that in regard to, of course, the directive issued by the president. We have seen very many stakeholders, the transport industry yesterday taking the precautions, equally the tourism industry, the hospitality industry, and how this is likely going to be the measure moving forward will be the right footing. Dr. Mureithi, why the hands then? Why not touch my nose? Why not touch my... I mean, this is a basic lesson. For instance, I prescribe to the Islamic religion, more or less 80% of the Holy Quran is science, and talks about the hands. You can't touch food with your bare hands because of a bacteria. And you are always advised to use either scoop or any other, way so that you cannot barely touch using your hands open food. And then the concern is that we normally do five times, we pray 5 times a day. Every time before we pray, we go for ablution, which is cleaning ourselves.
Cleaning.
You wash the hands, you rinse the water into the nose, the ears, the eyes, the hair partially, and then the legs before you go and pray. And I was trying to contextualize this, and more or less like I was in a biology class and understanding. So why the hands? Why are they so important in this regard?
Oh, I didn't know that about the Muslim culture. That's really elaborate, and it's good science and good hygiene.
Okay.
So end of the day, again, I'll take you back to our biology class. This virus, as I mentioned, really survives or thrives in this type of droplets. What are these droplets? Droplets is what we produce when we're talking, the saliva, from the mucus, where we sneeze, where we produce, again, some droplets. It needs, it thrives much better in this type of environment. So now when we are together, and very closely, I'm sure you've already spit out some droplets as you're talking. I may cough and I may be close to you. I will either take in those droplets or shake your hands. If you have sneezed on your hands, they'll have adhered at least on your surface. At the surface of your skin, of these hands. Okay, you shake my hand, and then there I go, because I love touching my face. I am rubbing my eyes, or maybe something in my nose or in my mouth, and then introduce your droplet that has the virus, God forbid, into my system. Again, then it will just start reproducing or replicating in this moist droplet-like area of the mouth and mucous membrane, the throat area. Again, I will turn to Kate, greet her, and whatever. It's very contagious, so she will get the droplets.
So in that case, we've created a chain.
So we've created a chain, and that's why you're hearing this word contact tracing, the people have been close by. And that's why you've been told to keep distance, wash your hands so that we can disintegrate this virus. And really, I want to emphasize, because it's a droplet type of infection, it will travel very easily within the community if we don't observe these measures. Remember the respiratory etiquette or hygiene measures. If you have to cough or sneeze because of natural human responses, either use a tissue, and if you're using this tissue, make sure you've discarded it safely. Okay. This is not the time to buy handkerchiefs, because you'll be tempted to put it back into your pocket and then back again, your hands again and again and again. If you have to cough, use the sleeve of your elbow. Yeah, so that we avoid just these areas where we are prone to touch and all. So that's why when I'm talking about this elbow greeting,
elbow greeting, and the leg greeting.
Let's probably stick to the legs, or Ilya. The Hindi, namaste. So that just really minimize this contact, that to facilitate these droplets that are carrying this virus to be transmitted to the next person. Okay,
Kate Kibara, then give me the significant element of the masks here. I don't want it to, from the understanding, not from the medical perspective. Of course, a nurse or a doctor will put it on, or the person who is infected. How about the person who has not yet contracted the virus? How important is the mask? Do we need it? And of what significance is it in the containment of the spread of the coronavirus or any other virus?
Yeah, when it comes to the mask, I remember on Friday when the first case was reported, everybody was in the supermarkets trying to get masks, in the chemists, all over the place. I was actually at one mall where masks had run out, the chemist was full of people. And we need to understand why we require to wear a mask. A mask is important for that person that is infected, if you're infected or you feel like you're at a risk, you've come from China, for example, or from a country that already has it, and you feel this period you're going to be in isolation, you can wear the mask. The medical practitioners at the hospital, if you're taking care of a sick person, if you're taking care of somebody who has the coronavirus or someone you suspect, not even the virus alone, at the hospitals it actually happens a lot. But if you are not infected with the virus, there's no need of wearing a mask. The mask is only to protect those that have it, such that you do not sneeze or cough, or when you're talking, the droplets go to a healthy person. So when you don't have, if you do not have corona, there's no need to walk around wearing the mask. And there's the risk of, if you wear this mask, in fact, you're told you wear the mask one off and that's it. You don't need to wear it. You don't need to wear it if you do not have the virus. The only thing you need to do after every maybe 30 minutes, 1 hour, 20 minutes, wash your hands. And before you wash your hands, do not touch your nose, do not touch your eyes, do not touch your mouth. That's the best way of preventing. You do not need a mask if you do not have a virus. The only people who need it are probably people at the airport who will come in contact when they're testing people, medical practitioners, people who will go to the communities to sensitize them. But you as a healthy person, you do not need to wear this virus, or if you're taking care of a person, to wear the mask, if you're taking care of a person who already have corona. And it's a specific type of mask. It's not just any mask that you can buy out there. It's the mask that has, is it alcohol, or it contains something. It's a specific mask that is worn in the hospitals.
That has a filter.
It has a filter that you should actually use. But if you don't have a virus, do not even get scared. It's only those that have the virus that should protect themselves from spreading by wearing this mask.
Okay. Will we also be taking a look at how important is it to safeguard the welfare of the people who are attending to the coronavirus patients, and our health response so far, the capacity, whether we can, what we need to learn from the lessons of the Ebola outbreak in 2014 when we deployed medical practitioners in West Africa to help contain the virus at the time, the outbreak in western part of the continent, which ravaged the countries in the Western African continent. I'll equally come to you, Kate Kibara, on the nutrition, or what needs to be done in terms of the diet by the person who is infected. But before that, allow me to come to Dr. Mureithi here. In terms of the isolation, before I come to the isolation, the most important element is that there are concerns about the immunity level, that there are some people who might not show the signs and the symptoms, but have the virus and are at risk of spreading that to the other populace or citizenry. They don't show any sign of fever, weakness, joint pains, or headache and diarrhea, as of course some of the symptoms outlined by the Global World Health Organization. What is their level of immunity here? I mean, how can they withstand that, or at some point it will show up?
Well, that's a good question. And yesterday a paper was published with that data on if that is actually true. If you're asymptomatic, so you're not displaying any symptoms, are you driving this transmission? And the paper actually had evidence that yes, it's possible. But now let's go back to these 14 days. So the earliest you can start exhibiting symptoms is probably, from the data we've accessed, is as early as day 2, but that's quite rare. But from day 5, you'll have more or less started having some symptoms such as fever, the dry cough, and the general tiredness. So within those 5 days where you're asymptomatic, but you have the virus in you that is, let me use simple words, reproducing or replicating, it's very easy to transmit it to somebody else. So that's why we are saying, if you suspect you've been in contact with someone who could be infected, if you've recently traveled to all these hotspots, and these hotspots now increasing day by day, please practice that self-isolation from that day 1 to all those 14 days, because within those 14 days, more or less you'll have developed some symptoms. So now, and probably Kate to tell us, our level of immunity is always different. Okay. So some people may exhibit their symptoms a little bit earlier. Again, the factors, there are so many factors from genetics to the immunity, and others slightly later. 2, there are people who have mild type of the infection. There are others who have very severe infection, and others who probably don't even have to be hospitalized. So all these levels of people need to be studied further to characterize how the virus is interacting with their system. But for now, if you think you've been exposed, out of all these factors. Even these healthcare providers who are looking after these people, they are probably being advised to not even go back home. Go to a probably containment or holding point where you can probably live there for another 7 days to make sure you're probably asymptomatic, not showing symptoms, but you can pass it on to somebody else. So it's very likely to pass it on. The paper has been published in a very reputable journal to show evidence that yes, you can. So that's why you really need to practice this self-isolation. And if you've been exposed, you probably not be put under quarantine, and we've seen all these areas now that the government has set up so that we can remove you from the community for a little bit so that you don't transmit it, pass it on to others.
Okay, immunity, which is a good note in terms of biology because it differs from one person to another.
Yes.
And that again, perhaps to me, brings in the aspect of how God has engineered us, we human beings who differ in different style, in different makeup, our component, and of course the manufacturer himself whose power and miracle is behind our comprehension always, all the time. Ket Kibara, if person A realizes that he has the infection and say he locks himself up in a room or his apartment for that matter, and a 3-bedroom, say, he stays alone, what does he need to eat? I mean, before he goes to Mbagathi, before that person goes to Mbagathi, or the government realizes that this person has the infection, what does he need to do to eat to stay in that room? And is there a probability that the virus will end if he practices the guidelines as provided by the World Health Organization before even going to quarantine center or an isolation center?
Well. Your immunity or your immune system is determined by your lifestyle and the health around you. So it is not just something that you'll just wake up that day and decide you're going to do it. I want to look at it from a perspective whereby we need to boost our immunity throughout our life. It's not necessarily a one-off event. Remember, this is a virus, and viruses don't have cure. What you can do is manage until it gets off, or you wear it off your system. So if you already have, and this is not only for someone who suspects, I'm talking about now everybody in general, what is your immune system? Your immune system is the first defense mechanism against any pathogens that may get into your system, that may cause disease or may cause some harmful effects to your body. And you have the immune system made of white blood cells, it is made of proteins, it is made of tissues, it's made of cells. So this is what needs to be kept strong enough such that even if I suspect that I have this virus within, like you're talking about, I'm already in self-isolation. So which are the immune boosting food? First and foremost, before you start eating, enough rest is important. When you rest, you give your body that break, and that break that your body you give your body when you're resting, it actually helps in boosting this immunity. So a good sleep or enough rest is quite important, especially sleeping enough between 7 to 8 hours, and this is advisable to everyone. We talk about when you're actually sick or not sick, probably in this period that you're talking about, and the rest of us who are trying to boost your immunity, first thing you need to do is you need to take a lot of fluids. A lot of fluids because, and I'm not talking about the sugary drinks, the soft drinks that we take, I'm talking about just plain water. Plain water actually helps your lymphatic system to wash off, to cleanse, to remove the toxins that could be within. So if you take enough fluids, if you're taking enough plain water, at this step, it will actually help in increasing the capacity of your lymphatic system, and this, at the end of the day, in turn, boosts your immunity. Secondly, now what you need to start doing is now add fruits and vegetables to your diet if it is not something that you do. There are vitamins and minerals that are actually important in helping to prevent or in helping to your body to produce the white blood cells to produce more antibodies to fight this. So buy oranges, but your citrus fruits, so vitamin C, vitamin E, vitamin A is quite important. So your fruits and vegetables, so you're now playing around with that. That's what you eat more of at this particular time.
All right, let me just pause. You'll continue. Allow me to pick this call from John Adamba, calling us from the county of Bungoma, wanting maybe to understand COVID-19, coronavirus, and his, of course, thoughts here on the program. Bushere John. Do we still have him? Mato. Yes, John, good morning. Bushere, habari asubuhi, my brother.
Habari ni mzuri sana. Daktari wetu Bosiere.
Tuko wazima wote, wako wazima. Tuko na daktari.
Yes, namuona nimemsikiliza vile anazungumza kwa njia.
Haya.
Rafiki yangu Abudi, wacha niseme namna hivi. Tunaona watoto sasa wametoka katika schools na wengine bado wanaendelea kutoka, wengine tumewapokea kwa maboma zetu.
Okay.
Yes, nataka kusema namna hivi Abdi, wengine unajua, wengine watoto wanasoma katika schools hapa na wanatoka sehemu mbalimbali hivi, wengine wataenda hata kwa mfano huko Bungoma, wataenda hata watakuja huko Northeastern, wengine wataenda huko hata Majidi huko, wengine wataenda huko hata Keseria ni huko Rungai Nairobi huko, wengine wataenda hata huko sehemu za Nandi, Rift Valley, wapi, everywhere across the country. Na ningependa kusema namna hivi. Bado inatisha na tujui wanaenda kukutana huko na nini au watapokea afya gani huko. So wakati watarudi, nataka kuuliza daktari hapa. Nataka kumwomba pia huyu daktari Minister of Education iweke mikakati kamili ili watoto watakaporudi aidha wapitie katika kipimo kujua kule mahali walitoka wanaweza kuwa wanakuja na nini. Haijulikani, wanaweza kwenda huko na wakakutana na hiyo virusi vya COVID ya corona. So wakati watarudi, naomba huyu daktari pia all doctors in this country or global, watoto watakaporudi katika shule Minister of Health na Minister of Education iweke mikakati kabisa ya kuwapima wale watoto. Yes, ya kuwapima wale watoto ijulikane wamerudi wakiwa na salama au wanaweza kuwa na kitu fulani.
Okay. Asante sana. John Adamba calling us from the county of Bungoma, making his submissions in regard to what we are having here and the concerns, of course, as is the case with other Kenyans, and John, who are looking at the government's efforts and measures to ensure that the pandemic is contained in the country. Yes, you had your point. Continue, please, as you finish up.
Yes, I was talking about what you actually need to have a lot of citrus fruits because they're high in vitamin C, or foods that are high in vitamin C, and vitamin C helps in attacking diseases, actually helps in boosting your immunity.
That's lemon?
So have lemon, have oranges, you can have things like pawpaw, anything that is in the citrus family. You can even have vegetables like spinach or broccoli that actually have vitamin C. So you're loading in this. You also need another important element called the beta-carotene. Okay. Beta-carotene is provitamin A, and this is found in like anything that is orangish or yellowish. So sweet potatoes, you have sweet potatoes, you have carrots. So include a lot of this in your diet because this one acts. Beta-carotene is a powerful antioxidant that actually, I could call it a killer cells. So when you take this beta-carotene, it helps in fighting all this the virus that is actually in your system. You also need vitamin E, and vitamin E will come from things like spinach, the green leafy veggies. So if you're going to introduce your traditional vegetables, tereres, managus, the spinach itself, the vitamin E actually helps in protecting. Also at the same time, when you're in isolation, or even any other person boosting immunity, add a little bit of nuts and seeds in your food. Zinc is one of the best nutrients that helps in immune boosting. And zinc comes from nuts and seeds, so sunflower seeds, watermelon seeds. So you're having your watermelon, eat plus the seeds, and any other nuts and seeds, even oats will have vitamin E that is actually very important. The healthy fats will also have vitamin E, very important in protecting and boosting your immunity. Apart from this, there are elements like selenium, and selenium you get from the whole grains. So if you have whole, it's an enzyme that it's a micronutrient that is powerful antioxidant that actually helps in boosting your immunity. It can be found in animal proteins. It can be found in vegetables. Take your vitamin D, so you'll go outside. Vitamin D is also excellent for boosting your immunity. So taking a lot of fluids will help. Taking enough rest and eating foods, with different colors. Each color represents a nutrient, and especially if you put in this that I've talked about. So you're having 4 different colors on your plate every single day, taking enough rest. And of course, at this particular time, if you're in self-isolation, try to reduce that stress because stress really affects your immune system. then reduce all the junk food.
Okay.
Anything that is high in saturated fats and high fatty acid, saturated fats and high in cholesterol is not good because it suppresses the functions of the white blood cells. The white blood cells are the ones that produce the antibodies to fight this disease. So if you're going to add this fat, it actually compromises it. So eat the nutrient-dense ones, and also remember one important thing that we actually never think about. 80% of your immune system is in your bowel, in your bowel, yes. And that is the first area when you ingest anything, the body actually tries to protect you because whatever that goes back into your bloodstream should not be harmful to you.
Okay.
So your bowel, how do you enhance that your bowel is healthy? First and foremost, you need to take probiotics. Probiotics is lactobacillus, the healthy bacteria that actually stays in the gut. And this healthy bacteria really promotes in boosting immunity. So you can add a bit of yogurt.
Are there examples of food that...
yes, you can add a little bit of yogurt. If you have things like kefir, you can add this. There are things like now, these ones are new, like fermented drinks like kombucha, but just adding a bit of
Does
yogurt.
musik fall in that category?
Yes, musik could fall in the best that category, but the best is the fermented one. So something like the natural yogurt is actually the best. So you're adding this such that now you're adding these live cultures, the bacteria in your system. We already have anyway, but it is depleted by eating unhealthy. So when you add these live cultures, you're actually now, when that virus, like she said, it sticks and all that, when it gets into your system, in the bowel, you already have a defense mechanism there trying to protect you.
Which and is, okay, go ahead, just finish up,
yeah, the healthy bacteria is quite important in boosting things. And then you need to take your good proteins. Proteins because you need to take complete amino acids, which come from the animal source. So lean cuts of meat, you can take fish, or you can take the vegetables, plant-based protein. So you have your lentils, you have your beans, you have your njahes. Why do you need proteins? In school, we learned proteins are body-building foods. So they actually help in strengthening your cells. They actually help in regenerating them. And in turn, this helps you in boosting your immunity. So generally, it's observing a healthy lifestyle and including specifically those foods that I've talked about.
Okay, generally, what you eat is you.
Yes, exactly.
Meaning you can be the primary defense point of all that threatens your life in regard to the bowel now being the start point of what will be ingested into your system and for your body to develop the immunity. Dr. Mureithi, we have a demonstration to do, but I presume we can do that towards the end of the program after the break as we finish up on that. And then after we come back from this break here on the program, we'll equally be talking about the impact it will have on our health systems and the priorities in terms of the medical resourcing, how the county governments and the national government can cooperate in time of need, and also the impact of the pandemic now and the lessons that we can learn in terms of rebooting our healthcare infrastructure in the country, because it's a time of calling. But post-coronavirus, post-COVID-19, then what we need to do to boost our healthcare systems in the country, though there are no healthcare systems in the world that were designed to withstand the coronavirus. That's why we're having the vaccine to be developed in Germany, in the United States of America, volunteers coming together and helping the global community. The number is 0791478990, the hashtag on Twitter is NewDayKE. The short SMS code is 40920. We are coming back after the break, and towards the end of the program, we'll be doing the hand washing session with Dr. Mureithi and Kate Kibara on what you need to do, how you need to do, how long afterwards you will wash your hands again in an attempt to keep at bay COVID-19 or coronavirus. Stay tuned. We're coming back after the break here on New Day Kenya. All right, welcome back. You're watching the program. We are into the final segment of the session, but we need to do some hand washing in regard to conveying that message out there that how important is it in terms of the hand washing process in an attempt to keep at bay the coronavirus crisis, and how important that is, and how important is it not to touch your face, your nose, your eyes to be specific, and in regard to how important is it also from the biological perspective as to why we need to wash our hands. Dr. Mureithi is here with me. We have the water, we have a bowl here, we have serviettes, and we have the sanitizer.
We have soap.
Therefore, now how do we undertake the start process, and where do we need to start? Let's do it practically.
So I'm imagining I'm at home or in a scenario like that where I have a tap. So first of all, let me talk about saving water, conserving water where we live in. So don't leave it running. First of all, just use a little bit of water to moisten your hands, and then use the soap.
The sanitizer, okay.
Yes. Okay. You don't have to use a lot of soap. If you're using a bar soap, make sure you lather it nicely, and you produce really good lather. Okay. If you feel it's not enough, then now watch. I am now using this because I have started the process of cleaning my hands. I don't want to make them dirty. So make sure you capture your palm very clearly. And then now I want us to capture all the areas of your hand, even the outer, the inner part of your fingers, the outer part of your palms. Make sure you capture also where the fingernails are, and not forgetting your thumb. So most people are saying, if you sing the song Happy Birthday to You for those 20 seconds, because that's what is being recommended, is very sufficient. If you are not familiar with the song, others are saying you can say the Lord's Prayer. Again, it takes around 20 seconds, so it's up to you what is sufficient. Making sure you captured all crevices, all corners of your hands. Watch, I'm going deep inside my thumb, deep inside the middle of my fingers, making sure my nails are well lathered up. And then from there, I'm going to rinse. So again, we are demonstrating here, but I would assume you have a tap. And if you have a tap, try and use your elbow. Again, running water is sufficient to make sure that you've captured all areas of your hand. Really, if you observe a surgeon, they more or less they'll clean their hands this way. Again, this is for demonstration purposes. I do not want to touch that area now.
You have touched already.
My hand is very clean. I have no droplets on me, so I want to make sure that I do not recontaminate myself. Rinse with copious amount of water. I know in our society, water is a problem. That's why I started this demonstration by saying do not leave the water tap running. Again, we need to remember we need to conserve. And I've rinsed out all the soap. And then really, if you have a towel, that's okay. If you have a tissue, even better. Make sure your hand is nice and dry. Okay? And then you can discard that. And then allow me to talk about, now my hands are clean, but we all have mobile phones. Mobile phones is where the next thing I'll touch. I want to check my WhatsApp messages. Make sure before you wash your hands, you have wiped down your phone. Okay? You can wipe it down with probably a towel that has a bit of soap. If you have a sanitizer, a good cleanup of your mobile, because remember this coronavirus can survive on a surface. Yes, for hours up to 2 days from the data we have observed. So make sure the phone can be a weak point. You've cleaned it before you've cleaned your hands. So now I can go take my phone and continue checking my WhatsApp.
Meaning everywhere we touch, whatever we touch is important we clean.
It's good to clean it, yes. And then make sure if you don't have water near you, you can use a sanitizer. It has to have 60% of alcohol. But really, simple soap and water is what we're advocating.
As long as the virus gets demolished completely.
Yeah, now, I know my hands are really clean right now.
Safe and sound now.
Yes.
Okay, let's get back to the discussion then.
Thank you.
Because there's also the important bit and the element of understanding perhaps as to the amalgamation of the virus and the other diseases in the country. Because when you read the journal oncology in the country in regard to, for instance, the prevalence and the number of cancer cases in Kenya, the concern is that we have an upsurge in the number of cancer cases. We equally have tuberculosis. As a country, we are equally struggling with other diseases. I mean, while these others do exist, how do we then, while paying attention to them, be adequate equally in terms of paying attention to the coronavirus crisis, and perhaps out of it develop a study that will help even the future generation and in the foreseeable future?
So in terms of, I'll answer your question from last to the beginning. In terms of research, we've been doing this for many years. Actually, I've been studying infectious diseases. And just myself, we are a big team. We've been studying these germs, these pathogens for many years, because we want to understand them. We want to understand how immune system reacts to them, because that way we'll be able to find a cure or vaccine. So coronaviruses caught our attention because of the severity of the infections you've seen so far that we've described. And really what we'd want to see is that more effort goes to this type of research. We have people we call virus hunters. Yani they go down to the forests, to the caves, assess these bats, assess other animals, assess even snakes, swab them, because we're interested to know what are they carrying and what is the possibility of this, whatever they're carrying, being transmitted to humans. Because now, remember, we've encroached where these animals live. We are selling them in Wuhan, you saw the market.
Yeah, the wet market.
In West Africa, there are delicacies that we would not normally eat, but may be carrying this infection. So we are actively doing this research. And also, I want to emphasize now, also in our setting, we've been on alert. So we're not starting from zero. We've not been caught pants down, let me say. We've learned a lot of lessons from diseases such as Ebola, such as yellow fever, that are endemic in our area. We have surveillance that continually goes on. So we are starting from somewhere. We just want to see that this surveillance, detection, and then listening to the instructions we're being told is really being taken seriously. In terms of our region, where we suffer other comorbidities, from the data you showed, you had a very good graph of showing the people who are most at risk for COVID-19, and you saw in the graphs that it's people who are 60 and above. These are people probably who have other underlying conditions, such as high blood pressure, kidney, diabetes, etc., etc. And to throw another spanner into the works, in our region, yes, we have all those underlying issues, but we also have other co-infections that we don't know how they will interact with COVID-19, which is a new infection. Such infections such as HIV, which touches the component of the immune system. We have TB, which is a pulmonary TB, which is an infection of the lungs. So we don't know how TB and COVID-19 will interact. We do not want to know, and that's why these really drastic measures are being taken for social distancing, this lockdown that we're seeing. But nevertheless, if you have HIV, you're living with these conditions, as Kate has mentioned, again, observe your diet. Make sure you're on top of your game in terms of ARVs. You're taking them because the ARVs really boost your immune system in terms of lowering your viral load. So just make sure you're as healthy as possible. If you can practice more stricter social distancing, if you have this other underlying condition, if you're elderly, protect yourself. Don't go into the crowds, don't go into the malls. Maybe this is not the time to go to church. Really, let's be that strict, or even most weddings and burials, because we really want to protect that age group.
Well, noted point. Briefly, before, in a yes or no capacity, many people, of course, there are myths and misconceptions. In terms of, we've talked about the surface where the virus can live for between hours to 2 days. How about on cloths, on plastics, because this is equally important?
Yes, yes, yes. And I've seen people wondering even about mitumbas that come in from China, letters. You say even our president has mentioned about we'll be cashless for now, because we have the M-Pesa platform, because it's been shown that this virus can survive on these surfaces for a bit of time. In terms of clothing or mitumbas that are being imported, let's relax a bit on that, because the distance and the time it takes for these bales to come through, the virus cannot survive that long. Again, viruses naturally need a living cell to be able to thrive. So within that period of time, but I would want to urge, if you're a bit worried about what you're interacting with, disinfect it fast. Which is perhaps
a better preventive mechanism.
Yes.
Kate Kibara, then, Dr. did mention an important point. Last week I was taking a look at an investigative piece done by 60 Minutes, an Australian broadcaster, about the wet market in Hong Kong, where it's believed that the virus, where it's believed that the virus from the animal came into contact with human, hopped from the animal to the human, and then to Wuhan in Hubei province. I mean, the concern is that there are bats, there are snakes, and other animals from Latin America to China, animals from Africa to China, a bat from the UK or the European continent to China. Many animals caged in a small room and are not in their natural habitat and therefore cannot dispose of what they ought to be in the natural setup. And that's where the virus started, hopped to human and the entire epicenter of the crisis. Does this mean perhaps that we should be lessening our interaction with animals, and how important is it? If we can't do without them, what measures do we need to also ensure that we abide by to ensure that the viruses in the animals do not cross over to humans?
A very difficult question where we're in a society like Africans and even around the world, we like animal protein. We like nyama. Without nyama, you feel like you're not eating. But I think it's important in this day and age to really watch out on the animal protein that we have. Not only do we have the viruses from, luckily in Kenya, maybe, I don't know which communities may eat bats or monkeys that are more prone, even snakes, more prone to have these viruses. But luckily, majority of us just eat cows and chicken. But we need to understand or now be aware of what that animal meat brings to you. As much as you're looking for these amino acids, the complete amino acids that you only get from animal source, we need to be wary of the way the animal was reared or the way the animal was grown. Apart from the viruses that these animals will contain, you have the antibiotics that were used to cure diseases that were in these animals. You have the hormones that are used to accelerate growth, such that in the chicken, for example, they grow within a short period of time. You also have all these things that are added, especially the antibiotics, will actually affect your health with time. So as much as you're running to get these amino acids, you're actually bringing your health down. So latest research, or what is happening around, we are being told to eat plant-based protein. It is important to include plant-based protein. As much as they're not completely, they do not contain all the amino acids, it's much safer. But if you include things like herbs, if you include a protein like mushroom, if you include a protein like soya, this one actually has the complete amino acids. Herbs like moringa, if you add that into your diet, you're kind of safe. So if you're going to eat the animal protein, look for organically grown, look for the lean cuts of meat, then ensure that your diet is more plant-based. And the plant-based means you're getting fiber, you're getting the antioxidants and the vitamins I was talking about, and you're at a less risk of getting the saturated fats and the cholesterol from the animal sources, the viruses, and any other things that we don't know, especially antibiotics that I've mentioned, and also the hormones to make these animals grow within a short period of time. So be wary, reduce your animal protein, take more of the plant-based, and I think with time, I've seen, like in China right now, they have banned the eating of wild animals. They have actually banned it because they have actually seen the effects. We would talk about it when Ebola came out a couple of years ago. We talked of monkeys spreading it. Even HIV, they've talked, came from an animal in a way. So I'm not so sure. So we need to actually, I'm thinking with time. With time, people will become vegans.
It's a complex matter. It's telling people stop and it's their culture. You know?
It's like telling me to stop eating camel milk.
Yeah, it's a culture. And also even cows and the milk could also be contaminated. We have bacteria. If you don't prepare it properly, there's brucella that is spread by contaminated milk. So really, it goes further. So maybe it's we tell people within this time, maybe reduce the amount of animals you take, or we can have governments looking at these markets, because there's so many illegal markets. Maybe have a regulation where these animals that you're selling they've been prepared properly, they're not being slaughtered and sold at the same place. You've seen that in the Wuhan market, it was a wet market, where all those things are happening. Have live animals, animals being slaughtered, people selling, people eating. So that mixture is quite lethal in terms of these pathogens.
Okay, still with you, Dr. Mureithi. When we are, of course, in the midst of this pandemic, technically, we are navigating the waters at the moment as part of the global effort, and Kenya being, of course, one of the affected countries across the African continent, and as is the case in Europe, in Asia, in Latin America, and in the United States of America. Given that, the people who are the epicenter of this to address the problem, give the public an understanding, ensure they advise the government properly, because I'm sure that the president could not issue the presser he did on Sunday without an expert advice from a doctor on the do's and the don'ts and the way forward, because this is the time we all need to listen to you, because you are so important. All the same though, how do we then come around or come about with measures to ensure that our nurses, our doctors are equally given all the requirements they need in terms of the protective gears and they don't get infected? And ensuring that in doing so, we don't overstretch, inundate, and more or less overstretch our capacity in terms of our healthcare infrastructure, and do it wholesomely under umbrella.
Yes, so again, the directives that Our Excellency the President has given does not come alone. He doesn't sit and think about it by himself. He has a whole team of experts. You've seen the committee, the emergency response committee, there are task forces, and within those committees, there are other several subcommittees that keep on updating these really important stakeholders, the policy makers that are coming with these directives. In terms of ensuring that we don't overwhelm our healthcare system, first, it starts with you. By observing these measures, hygiene, observing these measures of keeping that social distance. If we are told tomorrow we need to stay home so that we can cut the routes of transmission, let's adhere to that, because it starts with us, so that we can reduce or cut the rates of transmission of this infection. Because we do not want all of us, God forbid, get the infection, and then we all rush to these health facilities. We are going to overwhelm our healthcare system, which then it will not cope. And this is the cases we are seeing in Italy, in the US, who are very slow, in my observation, in observing these measures that we are taking up now. So really, I want to commend the CS, the President, and all who have faced this bull heads on. So now, in terms of ensuring that we all adhere to this, particularly in the healthcare facilities, this is where now the government and its structures need to ensure that we have enough masks. And how do we have those enough masks? Is telling people what Kate said, not everyone needs a mask, leave them for the healthcare providers. And so last night, it's called Alibaba?
Yes.
The Chinese billionaire, he's given each country 20,000 test kits, and I think each country within Africa is getting almost 1 million masks. That's really fantastic. We are really buying time to make sure that we are fully stocked and to make sure our healthcare facility and the system will be able to cope. But first, the most important way to make sure that they'll be able to cope, it's to adhere to these directives, to observe really strict hygiene. Because remember, our hospitals are not just dealing with COVID-19. Right now, there are people there who maybe have a road accident injury. We have cancer victims. So we don't want a scenario where this doctor will be like, so who do I treat first? This person who has this injury, or this person with COVID-19? We want to make sure that all these facilities are well distributed. We're not making them make those life-death choices, because I've seen they're doing that in Italy right now. They're looking at the elderly, who has the highest chance of surviving.
Like it's more like a war zone.
Yeah, we do not want to get to that. No.
Well, Kate Kibara, as we finish up, the important element here is the coordinated response. I earlier mentioned what needs to be done to intertwine and mesh the efforts by the county and the national governments. And in terms of the coordinated response that we need to have as per the containing of the coronavirus crisis, then how do we need to coordinate the efforts of the county governments and the national government in an attempt to ensure that we learn the lesson from the Italians or Italy, where the situation was misjudged, and then the government is now playing a catch-up game, or as was the case with Japan, who misjudged the situation in the port city of Yokohama when the people were quarantined in the Diamond Princess ship and they were not told to get off until a doctor went in. The doctor realized someone infected, and he himself was infected. He died in the ship, and then that was the toll point with which Japan got infected. Therefore, how do we not misjudge the situation, both at the county and at the national level? Develop a communication channel where the county administrations feed information to the national government. The national government, through Cyrus Oguna, speaks to the nation in regard to the numbers we have, the containment measures, what we need to do, how to prevent it, and keep the Kenyan population safe.
Exactly, you've answered it. I think that coordination from the county government. I'd like to give a scenario, an example. I was in Europe, the same area, not Italy. I was in Germany. And I wondered why they're not responding so much. I was there in February. Why they're not responding? Why nothing is happening? So when, and they kept saying there are cases, and it was a slow response. What I've seen here, and as soon as the first case was announced, the person was traced where they had gone to. I think it was Rongai. They went and fumigated that area. We are always, if you open any radio station, if you listen, they're talking about how preventive measures within 3-4 days. A lot is actually happening and everybody is talking about it. So I think the most important thing is to have a clear channel such that there is no communication gap whereby maybe somebody in Busia entered through the Uganda border and the county government in Busia do not know what to do because they are not working with the national government. But I'm very sure all these things are now being coordinated and they are working hand in hand to ensure. And something that keeps us on the safe side, we've already tackled, Africa has already tackled, I don't want to say much more serious, but things like Ebola, which had a 90% death rate. You know, you get it within 24 hours, you start oozing blood from all the orifices. So it means that we are already prepared in a way because we're used to such. So I liked the fact that as much as it was one case, there was a lot of response going out there. If you look at everyone, I'm talking about maybe Nairobi, if you look at social media, there are a lot of people talking about it because they're already aware of it. Oh, you need to clean hands. But the most important thing then, what the county government, as they're working with the national government, we need to only get information from one source. Because if you start getting information from different points, you'll start getting misinformation because people are coming up with their own stories. People are coming up with their own myths. So once the county government works with the national government, and then of course now the government spokesman comes out and tells us what is happening. So all these other channels we need to be very wary of and just know where the information comes from. And lastly, I would talk about maybe myths when it's related to how to prevent, oh, go take a garlic, I'm a herbalist out here, come and visit me, I'm going to prevent you from corona. Let's avoid all this. Let's follow what the government is saying, and the county government for sure needs to coordinate with the national government. And once we act and observe all these rules, I'm very sure, and I'm very certain we'll be able to contain it and control it before it becomes serious in the country. Okay, and of course to prevent the misinformation and the misguided notion among many Kenyans and those who are out to extort money from the public in regard to the coronavirus crisis. And of course the government yesterday swiftly responded to the clinic here in Hurlingham, Nairobi County, that was selling coronavirus test kits for 15 minutes, 3,000 Kenya shillings. You send the money and apparently they were running out of stock. But thank you so much, Dr. Marianne Mureithi. Thursday night we'll still be here still in regard to coronavirus crisis, and we'll be of course talking about this matter in regard to the perspective from Europe, and equally a big thank you to Kate Kibara, colon hydrotherapist. I appreciate your time, your input in regard to the basic understanding and what we have done, and equally she is clinical nutritionist and has told us what needs to be done to eat and how you need to balance your diet in such times if you get infected or otherwise generally for the good health of your body, what you need to eat. And the crisis, though, equally has caused global concern in regard to the shutting of borders in Western Europe. Germany has shut its borders with Austria, Poland, so is Spain with Portugal. The United Kingdom's Prime Minister Boris Johnson has said no non-essential movements, people should not be gathering around, no public gathering, no meeting in restaurants, pubs and bars. And equally that was the call, the clarion call from the President of the United States of America, Donald Trump. And we'll keep monitoring the airspace around Europe and in the United States of America as Africa continues to come up with preventive mechanisms with regards to the latest cases that we have in the continent. Kenya on Friday last week, 1 case, 2 doubling up to 3 as confirmed by President Uhuru Kenyatta on Sunday. Somalia, the Democratic Republic of the Congo, Angola, Algeria, Egypt, Senegal, Nigeria, Togo, and all the other African countries affected, and equally in China, which has so far managed to contain the situation with only 1 case reported so far, and that was from outside Hubei province in China. And now China helping out other countries, especially in Europe, in Spain, in Germany, in Belgium, in the UK, in the United States of America, with the prospect of a vaccine in the next 6 months or so, and the global economy
has taken a hit for that matter. I'm Abdikadir Abdi. A big thank you, Dr. Marianne Mureithi. She is the Chair Department of Medical Microbiology at the University of Nairobi. Thank you so much. Kate Kibara, colon hydrotherapist and clinical nutritionist. And thank you to you too. We leave you with the graphics of the day, what you need to do, what you don't need to, because we, the members of the Fourth Estate, have the responsibility to ensure that the public is educated, entertained, as is more or less the basic lesson in a journalism class, but this is far more than entertainment, and it's a matter of education, bringing to your understanding what you need to do, as is the case with the one man who always wanted to understand what needs to be done, Shadrach, who is our cameraman, and Suleiman and the team behind the gallery who are making this program great. We'll see you tomorrow here on New Day Kenya. Good morning.